My name is Sheryl Barker, and I work at Scenic Bluffs Community Health Center. We have offices in Cashton, Norwalk, Sparta, and Viroqua. And I am the CFO here, Chief Financial Officer, and I have been here for 15 years in July. I do a wide variety of things. I oversee everything in what is called the revenue cycle, which goes from when the patient first makes a phone call and does scheduling, to when they come in and check in and we verify their insurance, to after they've seen the provider and we now have to bill their insurance or themselves for the visit that they had, and any conversations with patients or outside bills that are related, we also do. Finance also oversees accounts payable, so all of the expenses that come into the building and need to be paid are also overseen by my department. Personally, I do work on the budget, and I have to work with all the other department managers in order to make sure we create a good budget, which starts with what our staff is and goes into what our productivity is, how many patients our providers are seeing, and then the costs of the visits that associate with that, along with all of the fixed costs of having buildings and things like that. I work with other professionals that are in the health field, but maybe not directly healthcare providers. I am on the boards of both Southwest Tech and Western Technical College, and for their HIT programs, their Health Information Technology programs, and so I interact with a lot of other health professionals on those boards in order to try and help create good programs so that we get a good workforce. My job is important to patients' care because patients are often very concerned about what their cost of care is going to be, and my team helps them understand those costs, walk them through the process, make sure that whatever coverage that they might have, that we can have somebody else assist with paying for those services, that we reach out to that and we collect that information so that we can do that, what's best for the patient. We have a lot of conversations with patients who can't necessarily pay their bills in full when they get their statement, and we work with them to put them on payment plans and make sure that they understand that. Another thing my team oversees is our sliding fee program, which we call the Healthy Neighbor Program. And as a federally qualified health center, that is something that the federal government requires us to offer. And what it is anybody at or below 200% of the poverty level is eligible for a discount on services here. And so my team manages all the applications for that program, classifying where the patient might fall in the program, and then making sure that the appropriate discounts are applied to that in order for a patient to better be able to afford their care. My position description requires a bachelor's degree, hopefully in business or equivalent experience. I personally have a bachelor's degree in accounting, and that background is important so that you can manage the financial aspects of it. Having supervisory skills is also very, very important, so management is also a critical skill. I also have what is called a CNAP, a Certified Nonprofit Accounting Professional certification, and so that was a 3-day class that I took, and gives you more background in how to do financials for a nonprofit organization, because the financials for a nonprofit organization are different from a regular corporation. I personally actually have a master's in servant leadership, which has greatly enhanced my ability to work here. It has really helped me with the supervisory skills, the interpersonal relationships, and those types of skills that you don't necessarily get as an accountant. Really encourage starting out in the health information technology programs. There are a lot of associate programs in that. There are also 4-year programs in that. It gives you a really, really good base. Having the business degree is also, as I said earlier, important to give you the understanding of how to do financial reporting and how to do financial analysis, and make sure that you are assisting the business in being fiscally responsible and maintaining a good business sense. The best part of my job is when I actually get to interact with a patient and usually when that happens, it's because the patient has had other unsuccessful encounters with other staff, and I am now talking to them to try and help them work through whatever it is issue that they're having. And usually we are able to come to an outcome that is mutually satisfying, and the patients really appreciate that extra help and assistance. And since I don't get a lot of patient interaction, it really makes me feel great. The most challenging part of my job is just managing the variety of duties and responsibilities that I have. The position requires a lot of meetings, which eat up a lot of the time in the week, and a lot of the projects that I need to work on, such as the budget or other reporting requirements, are usually larger projects that take up a large chunk of time, and maybe a large chunk of time over a few days. And sometimes that's really hard to set that time aside when you're trying to be supportive to the staff and attend meetings or just chat with them and help them work through the issues that they're having. I moved to Cashton, which is a rural community in western Wisconsin, and have been an accountant in the business world, in the regular corporate world, and was looking for a job. And I actually started here as a part-time 20-hour-a-week accounting assistant. And once I got into the job, obviously the tasks I knew I was capable of. What I didn't realize is how much I love the nonprofit world, because we are doing good by our community, and we're really supporting our community and reaching out and making it a better community. And that part is what really gives me the satisfaction. And when I say community, it's not just the patients, it's our staff, because many of our staff members are members of the community, and then people that maybe are unrelated to the health center. Just the fact that we're able to bring an organization like this to such a small town, it makes it a great place to live. The job outlook is great. As insurance becomes more and more complicated, we need more and more people that understand those intricacies of what insurance companies are expecting in order to keep the financial gears moving. You could really find your niche in what you're interested in, whether it's in coding, where you actually look at providers' notes and decide what the coding should be, or credentialing, where you work with insurance companies to get providers signed up and make sure that all the licenses and documentations that are needed are there. It's really anything that you might want to have an interest in is available there. It really depends. We here at the health center, we start people that have absolutely no knowledge whatsoever at above minimum wage, but a lower wage. There's opportunities to move up through the ranks, and as you move up through the ranks, the wages do increase. Healthcare is a very viable career for lots of upward mobility, and so it's really how much time and effort you want to put into it, and how much interest that you have, and what experiences you can bring, and I mean, the sky's the limit. Try out different aspects. Don't try and pigeonhole yourself from the beginning. Be willing to take those elective courses that might lead you in a different direction. Make sure that you create a good base, because if you have a good base, then you can continue learning and go in whatever direction that you want.